Have you ever wondered if the pills you're taking daily might be quietly harming your heart? As we age, the heart becomes more vulnerable. What's truly alarming is that some of the most common everyday medications for pain, allergies, diabetes, even contraception could become silent enemies of your cardiovascular health if not used wisely. Today on Golden Health 365, we'll uncover 6 widely used medications that may significantly increase your risk of a heart attack or stroke, especially for those over 50 or with existing conditions like diabetes, hypertension, or high cholesterol. If protecting your heart is your priority, don't forget to subscribe and turn on the notification bell, because every week we bring you science-based, easy-to-follow health insights tailored for longevity and quality of life. 1. Hormonal contraceptives. Empowering but risky. Hormonal birth control has given women powerful control over their reproductive health. However, if you're using combined estrogen-progestin contraceptives, in pill, patch, or vaginal ring form, you may be unknowingly doubling your risk of heart attack and stroke. A large study of over 2 million women in Denmark found that users of combined hormonal contraceptives experienced 1 additional stroke per 4,760 users and 1 additional heart attack per 10,000 users per year. The reason lies in estrogen's effect on the blood. It increases clotting factors, creating a prothrombotic state, especially dangerous for women who smoke, have high blood pressure, or elevated cholesterol. Vaginal rings in particular were linked to a 3.8-fold increase in heart attack risk. Golden Health 5. Tip: if cardiovascular risk is a concern, talk to your doctor about switching to progestin-only methods, especially the progestin-only IUD, which has not been linked to any increased heart or stroke risk. 2. NSAIDs. Quick pain relief, long-term cardiac risk. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, diclofenac, and naproxen are household staples for headaches, arthritis, fever, or back pain. But few realize that these go-to pain relievers can increase the risk of heart attack and stroke, sometimes within just weeks of use. NSAIDs work by blocking COX enzymes, which produce prostaglandins, important not just for inflammation, but for protecting blood vessels and regulating blood flow. When prostaglandins are suppressed, the balance of vasodilation versus vasoconstriction is lost, making it easier for blood clots to form. FDA warnings emphasize that this risk exists for both over-the-counter and prescription NSAIDs and increases with higher doses and longer use. Diclofenac is especially risky for heart health, while naproxen appears safer by comparison. Golden Health 65. Tip: use the lowest effective dose for the shortest time possible. Avoid NSAIDs if you have existing heart disease, high blood pressure, or diabetes. Monitor your blood pressure during use and consider safer alternatives when possible. 3. Rosiglitazone. Blood sugar control with a cardiac price. Rosiglitazone was once hailed as a breakthrough drug for type 2 diabetes. It enhances insulin sensitivity, but at a cost. It also causes fluid retention, alters lipid metabolism, and places extra stress on the heart. A 2007 analysis in the New England Journal of Medicine revealed that rosiglitazone increases the risk of heart attack by 43%. Other studies confirm a notably higher risk of heart failure, particularly in older adults or those with pre-existing cardiac issues. Golden Health 365. Tip: if you're currently taking rosiglitazone, speak to your doctor about safer alternatives. Many newer diabetes medications offer blood sugar control without compromising heart health, especially for older adults. 4. Antidepressants. Mind at ease, but what about the heart? Depression becomes more common as we age, but treatment must be carefully chosen, especially if heart health is already a concern. Tricyclic antidepressants, TCAs, like amitriptyline, can cause orthostatic hypotension, dizziness when standing, fast or irregular heartbeat, prolonged QT intervals, a risk for ventricular arrhythmias. Selective serotonin reuptake inhibitors, SSRIs, are generally safer, but citalopram and escitalopram may still prolong the QT interval at high doses. Golden Health 365. Tip: prefer SSRIs over TCAs if you have any cardiovascular concerns. Have your ECG monitored regularly, especially if taking SSRIs long-term. Never self-prescribe antidepressants. Always consult your healthcare provider. 5. Pseudoephedrine. Clears the nose, clouds the heart. Pseudoephedrine, a common decongestant in cold and allergy medications, shrinks swollen nasal tissues by constricting blood vessels. But here's the catch. It doesn't stop at your nose. This same action can raise blood pressure, increase heart rate, trigger angina or heart attacks in vulnerable individuals. Even in healthy people, high doses or prolonged use can lead to cardiac stress. Golden Health 365. Tip: always check labels when taking cold medications, and avoid pseudoephedrine if you have heart disease, hypertension, or arrhythmia. Ask your pharmacist for alternatives with a safer cardiac profile. Inform your doctor of all medications you're taking, including over-the-counter drugs. Dear friend, heart health isn't only about eating right or exercising. It's also about understanding what you put into your body every day. Medications can be powerful allies, but only if we use them wisely. By staying informed and making conscious choices, you can protect your heart and live fully, with clarity, energy, and peace of mind. If you found this video helpful, click like to support our mission. Share your thoughts or questions in the comments. We love hearing from you. And don't forget to subscribe to Golden Health 365 for weekly insights designed to help you live longer, healthier, and happier. Until next time, stay strong, stay wise, and stay kind to your heart.